In this lesson, we will more focus on clinical protocols, possible and optional clinical protocols and treatment considerations when we apply different types of abutments, different types of materials, and consider in vivo and in vitro findings. Now, the learning outcome of this lesson is to understand the broad range of treatment options that we have available today, and also understand the limitations in regards to scientific evidence for certain routines that we have today when it comes to implant abutments and the long-term outcome of different protocols and procedures. As has been explained in the previous lesson, it is not necessarily only the clinical approach that is used or the choice of abutment, but it is rather a combination of different factors that leads to long-term success or long-term failure. One of the most relevant and most often discussed subjects today in regards to implant abutment and implant bone restorations is certainly which clinical protocol is superior to another. And when we look closely into literature, there appears to be a significant knowledge gap in regards to immediate delayed or late implants, because there are controversial results when it comes to long-term outcome, and especially the scientific evidence supporting one protocol over the other is simply lacking. Therefore, it needs to be decided on an individual case-by-case and certainly experience level by the clinician which approach he deems most appropriate for his or her patient. As an example, I would just like to point out 3 different approaches in this lesson today, which may be a treatment option for you when you consider treating your patients depending on the initial clinical situation. I would like to start with an immediate implant insertion case and immediate provisionalization. Just as I explained earlier, this is one of the topics that is currently applied more and more often, and we need to be sure that whatever we do in these regards is leading to comparable success if we compare this to a conventional 2-stage approach. Now, as has been explained in lesson 1, orthodontic site preparation is a viable tool that we have available today when we have basically intact peri-implant tissues, when we have only the root that needs to be removed, we have an intact buccal plate. Then we can consider in these patients, which is a very low percentage of the entire patient population that we see today, but we can see that we improve the surgical site or improve the implant recipient site to compensate or overcompensate for the expected tissue remodeling after tooth extraction, after implant insertion and final connection of the definitive restoration. So if we overcompensate for the expected shrinkage and remodeling, then we can certainly apply in these cases a very minimally invasive protocol where the tooth or the remaining root is carefully extracted after a significant healing or waiting period after the extrusion to give the tissues time to mature. If the implant is placed and if a provision is placed immediately, we can see on the right side the clinical situations after a 4-month healing period, and then we can continue with our definitive restoration. What have we done through this approach is certainly that we maintained and stabilized the existing peri-implant soft tissue architecture, and therefore do not need to sculpt these tissues over several weeks or months with provisional restorations. So basically just the maintenance of what is available. Whenever we use any approach where we use an immediate provisional, we should certainly, if the tissues are stabilized through this provisional, we should definitely transfer this information, the contour and the shape of our provisional information, to the dental laboratory so that an exact replica definitive abutment can be manufactured. The clinical approach behind this, or the technical approach, is very simple and straightforward. So we basically only need an impression coping implant analog and the provisional itself. These are screwed to each other and then inserted into an impression material.